Okay, now we're going to talk about the gait belt. You're going to use the gait belt on any of your ambulatory patients, okay? We have two kinds of gait belts over at the hospital. We have the single patient multiple use that goes home with the patient at the end of their stay, and we have the black one, which is multiple patient, multiple use, wiped down in with the appropriate germicidal. Couple things about the gait belt. When you put it on your patient, make sure that the label is on the outside, okay? You're going to put it around their waist and you're going to put it snug. Lift up the teeth of the gait belt and push the end into it. Okay, label out. And put it on nice and snug, okay? You want to put it on just snug enough so that you can put a couple fingers underneath. Now, one of the things to pay attention to, a lot of your patients have incisions, tubes, wires, pregnant bellies. Just be aware of that. You can move this gait belt up higher so that you're away from it. But being snug is really important, okay? So to get your patient up into standing, they're going to lean forward and they're just going to come to stand. Now, if you have to help them up from that sitting position, it's an inappropriate piece of the equipment, okay? When you use this, I want your hand to come underneath the gait belt, okay? Palm up. And when you stand next to your patient, think about standing slightly behind them and just off to the side. And as you move with your patient, and if your patient were to attempt to start to fall, what you can do with a big base of support, open up your legs, that patient can come down, land on your knee, and then you can let them slowly down to the floor.